Yemen is fertile ground for cholera. When this outbreak began almost 6 months ago, conditions were perfect to help the disease spread. 30 months of war has stopped virtually all public services. Airstrikes have destroyed water treatment and other infrastructure. Filth is everywhere. More than half of all the health facilities are destroyed or only partially working. Hospitals and clinics that are still standing are overwhelmed, especially with infant and elderly cholera patients. Oxfam says there are more than 5,500 cases a day.
Cholera is a very easily treatable disease, but it's very difficult in Yemen with an active war that's happening. It's difficult for people to access healthcare. We have about 15 million people in Yemen who don't have enough access to basic healthcare. And we also have a situation where basic infrastructure and essential services are collapsing.
The fighting in Yemen between Houthi fighters and a coalition of countries led by Saudi Arabia has killed more than 5,000 civilians. Another 3 million have been forced from their homes and are most vulnerable to cholera. They're weak from hunger and have little money to buy medicine. The war is making it difficult for aid agencies to get into Yemen. Oxfam and other help organisations say obtaining visas for cholera specialists can take up to 2 months. Medics who do get in say it's difficult to move around freely because of military restrictions. Bernard Smith, Al Jazeera.